So today I thought we would discuss expressed emotion in family systems. It's a term I think most of us have heard of and are pretty familiar with and probably observe more often than we realize. So we're going to talk about the definition of expressed emotion, talk about its impact that it's having on the family systems with which we work, and also talk about the importance of assessing for expressed emotion with our coordinated specialty care for FEP participants and their loved ones, as well as ways to address this within the entire family system. So, expressed emotion is a pretty common pitfall amongst family systems, not limited to just those who have serious mental health issues within the family, but commonly amongst those with serious mental health issues in the family. So it involves, critical or hostile or emotionally over-involved attitudes that lead to behavioral responses. So it's typically thought of as, how family or natural supports their attitudes towards the participant in an FEP program. But it's important to recognize the bidirectionality of relationships within a family system. So participants may also make harsh or critical comments to their loved ones. So we do know that home environments that are high in expressed emotion do lead to higher levels of symptom relapse, especially following an acute episode or a hospitalization. We know that individuals returning to a home that is high in this sort of critical or harsh environment, or those who are overly emotionally involved in what's happening, that they're really 2 to 3 times more likely to experience a relapse of symptoms in the 9 months following their discharge from a hospitalization. And we also know that those who are more cognitively vulnerable, this impacts how these critical comments are processed. Depending on how they're processed and absorbed, this contributes to the level of distress experienced as well as to their response, behavioral and emotional responses to these kinds of comments. Expressed emotion, though, is not a sudden occurrence within family systems. This is something that really does develop over time, and that's due to several factors. Things like the personal history or events within members of that family system, personal variables or attributes of each member of that family system, what differing individuals within that family system are attributing the mental illness to. Is it attributed to the individual themselves, to another loved one in genetics? Just varies within family systems what people are attributing the illness to, and also the various relationship factors and dynamics within that system. So, family members or natural supports that do exhibit high levels of expressed emotion, they are typically responding from a place of fear for both the participants' future as well as the entire family system and those individuals within the system, the future of those individuals. So, although, these harsh or critical comments can feel as though it's from a place of contempt or lack of caring, typically it really is from a place of fear. And I think that's important for us as team members and providers to remain aware of, and to work from a place knowing that this is typically coming from a fear-based situation. Expressed emotion might be an indicator of how family members interact with one another because attitudes are associated with behaviors. And so, if people have these sort of critical thoughts or frustrations with a member of the family, this in turn is how behaviors are expressed or responded to. And so, family members that are exhibiting high expressed emotion also display more negative behaviors when interacting with the participant, especially during problem focused discussions. And I think that that's an important piece to highlight, and we'll talk about why. When working with family systems within, FEP programs, two target areas, especially within family psychoeducation, for example, that we like to work on and emphasize are both communication and problem solving. Expressed emotion is, often addressed in the communication sections of family psychoeducation or the work that teams do with participants and their family or natural supports. And I always recommend, working through the communication sections or working on communication skill building before moving into problem solving, because you want to address things such as expressed emotion before you start addressing problem solving, because we know that there's a natural breakdown when there's high levels of expressed emotion and they're trying to solve problems anyway. So trying to make sure that we address communication prior to problem solving. So one of the primary goals of communication skill building is to reduce levels of expressed emotion when this is applicable within a family system, and it's not all family systems. And this is done by learning how to speak and negotiate and really listen more effectively. Um, you know, these communication skills really we should be talking about, including how expressed emotion developed within this particular family system because it looks different for everyone. The participant and the individual family members individual processing of and response to that negative affect or critical comments by people that they care about when they're making these comments towards them or about them. The level of reactivity of the participant and loved ones to harsh or critical comments or emotional over-involvement. Um, we should be including skills in how to navigate difficult family dynamics and interactions, and also working to help the participant and the loved ones to develop some self awareness as to what behaviors they might be engaging in that kind of promotes or provokes or promotes some of these attitudes from those around them. So, just making sure to keep that in the back of your mind as you're working through communication skills as a team with a participant and a family system. And really importantly, as coordinated specialty care for first episode psychosis teams, it's very important that we are assessing for as well as addressing expressed emotion from the very beginning of engagement with the program or with the team. There are a variety of assessment tools out there. The gold standard tool is called the Camberwell. That's a wonderful tool. However, it does require training and it can sometimes be time consuming. So I included some other options. I personally like the family attitude scale and have included a link to that. But there are other options out there for sort of quick um, assessment tools of expressed emotion within a family unit. Some look at the all participants engaging, the family members and the participant. Some just look at the family members engagement. Some involve observations of a 5-minute family interaction. So it just depends on your level of comfortability, what your observations are early on, to see which tool might fit best for you. And so Hooley and Parker, and I've included that in the references, is a really nice review of the measures so that you can decide which one might be a fit for you and your team. So references included, and I'd be happy to take any questions, or you can always feel free to email me with any questions that you might have related to this talk or anything related to family work. So thank you for your time.